So in this video, let us see the difference between the Quaba and the extended Quaba flaps. So this is a difficult defect for which there are very less options available. Let us see the planning. What we are marking are the metacarpal heads. These are the rough markings of the metacarpals. Between the metacarpals, we plan both the Quaba as well as the extended Quaba flaps. Now, proximal to the metacarpal heads, roughly around 0.5 to 1.5 centimeters, is the dorsal metacarpal artery perforator on which the Quaba flap is based. Now, if we measure the distance from the perforator to the distal edge of the defect and replicate it in the intermetacarpal space, if it is x, both are x, the flap becomes quite long and it might even cross the extensor retinaculum, which is not a good option. The flap becomes unsafe flap. So we can base our flap, which is based on the perforator in the web space. So in web space also there is a perforator. So if we measure the distance from this perforator to the distal edge of the defect and we replicate it in the intermetacarpal space, our flap becomes a fairly smaller flap. When it is based on this, it is called as the extended Quaba flap. Now let us see. So web space perforator is the extended Quaba and perforator proximal to the metacarpal head or the neck is the conventional Quaba flap. Now let us see the anatomy. If we see A is the dorsal metacarpal artery and we have a perforator of the dorsal metacarpal artery at the head or just proximal to the head, which is C, on which the dorsal metacarpal artery perforator flap is based, which is also called as the Quaba flap. Now, if we see F, it is the deep palmar arch. The deep palmar arch traverses in this particular fashion and communicates with the dorsal metacarpal artery, and at that point also it gives a perforator. In this case it is D, which forms the basis of the extended Quaba flap. So these are the differences. Thank you.